we are live, Stephen. So we're going to get started, play my little jingle, and we're going to get into it.
All right.
Hello, everyone, and welcome to Tangy of Life. Tonight is a different tangy tea, just a little different. Here we talk about any and everything. And first of all, I'm your host, Veronica, back with you tonight. My co-host, Victor, and Fatine is not with us tonight. So it's me, myself, and I for this very special edition of Tangy Tea of Life. I have joining me tonight Mr. Stephen Edwards, the executive director of the Free Medical Clinic of Darlington County. Welcome, Mr. Edwards. How are you tonight?
Oh, Veronica, I'm great. Thank you for having me. Glad to be here.
You're so welcome. I know if anything like me, I had an extremely busy day today, so I'm not going to hold you up because I know you're probably ready to settle down, get things kicking for tonight. So I'm not going to keep you long. I appreciate you for joining me tonight to talk about something that's so important, which is health benefits. A lot of people are experiencing hard times. We all know that. A lot of people do not have health insurance. Others can't afford health insurance on their jobs. So we are here tonight to let our viewers know about the Free Medical Clinic of Darlington County. Now, you are a 501 C3 nonprofit organization, correct?
Yes, ma'am.
So let's jump right into it, Stephen. Do you have to be a Darlington County resident to take advantage of the free clinic?
Yes. The Free Clinic of Darlington County is specifically for Darlington County residents, but since the airwaves don't stop at the county lines, let me point out there's a free clinic in Florence County, Mercy Medicine. There's one in Dillon County. There's one in Chesterfield County. So there are 42 free clinics around the state. So
Wow.
ours is designed specifically for Darlington County residents, and that's generally how we're all set up.
Right.
We're all independent, but we're kind of a loose network that all do the same thing.
Right. Now, I'm going to be honest, Stephen. I knew there was a free medical clinic in Darlington. I'm a Darlington native here. But I always forget about the free clinic. And like so many other people, I'm quite sure they either don't know that there's a free clinic here or they just completely forget about the clinic. So that's exactly why you are here tonight. And I appreciate you so that we can let people know about the free clinic. Now, what are your hours of operation, first of all, in the days of the week that you're open?
Well, first of all, let me point out there are two clinics. There's the primary clinic is in Darlington at 203 Grove Street. It's kind of right behind Singletary's Auto and St. Matthew's Church, right off of St. Matthew's, right? And it's very conveniently located to a PDRTA bus stop. Our Darlington clinic is open Wednesday, Thursday, and Friday. And hours vary, and I'll tell you more about that in a little bit. Basically, we're open from 9 to 5 on Wednesday in Darlington, 11 to 7 on Thursdays, and 9 to 4 on Fridays. But our satellite clinic is open in Hartsville on Mondays and Tuesdays. So the same staff works both clinics. It's open in Hartsville, West Carolina Avenue, on Mondays from 9 to 5 and Tuesdays 11 to 7. And historically it's been with the clinic nights, our traditional clinic nights are Tuesday and Thursday nights. That doesn't mean we don't see patients other times, but we specifically have later hours on Tuesday and Thursday, so that we can take care of people that are working during the daytime.
Gotcha. So, do you accept any age groups? Because it's like it's a health clinic, so it's no age limit that you will not accept. Is that correct?
Well, yes, Veronica, there is. I mean, we are set up in the free clinic of Darlington County grew out of another hidden treasure in Darlington County, the Lord Cares Food Bank. And discussions about the free clinic started in 1995, and we opened our doors in July of 2020. So we're almost 21 years old. We are set up to take care, to provide primary care to uninsured, low-income residents of Darlington County. So if someone has private health insurance, Medicaid, or Medicare, we are not able to see them, not necessarily because we don't want to, but we're trying to fill that void. You know, you've got the Genesis and the McLeod and the MUSC here in Darlington that see the insured. Right. We see the uninsured. So patients that are not 18 or younger and low income are eligible for Medicaid, and 65 or older are eligible for Medicare. So we focus on that group in between, 19 to 64.
Okay, 19 to 64. Okay, so the qualifications, I should say, is required to become a patient, correct?
Yes, ma'am.
So what are some of those qualifications that people have to have in order to be able to be seen at the free clinic?
We basically covered most of them. You have to be a Darlington County resident. Mm-hmm. You have to be ages 19 to 64. You have to be uninsured. Now, there's one exception to that. Those people that have Medicaid family planning, excuse me, mm-hmm. we are able to see them because the family planning takes care of other things that we don't do anyway. So Darlington County resident, 19 to 64, uninsured, and are below 300% above the poverty level. Now that's a mouthful. Mm-hmm. Let me break that down into some strict dollar amounts, okay? Mm-hmm. If you are a single person and make up to $38,280 a year, you qualify financially to be our patient. So that's 300% above the. If you are a family of four, if you have 4 people in your household, you can make up to $78,600 for your family and still be our patient. So, you know, $78,000 sounds like a lot of money, and it is. Mm-hmm. But when you've got rent and car payment and car insurance and utilities and groceries and shoes for the kids, that 78, it goes away pretty quick. So,
gotcha.
So we have it's not as restrictive as it once was. For the first 20 years, our income limit was not that high. Mm-hmm. It was 200%. But for example, I left a state job at the end of 2018 to become the executive director of the free clinic. So I left state benefits. Now, I have been administering benefit plans for a county government, and the Affordable Care Act made, insurance available. But what the government doesn't want to tell you is it's very expensive for not great coverage,
Exactly.
Or it's bad coverage for free. I'm not dinging the government, but that's what I found. When I got off the state plan, it was going to cost me $900 a month to insure just myself. I'm a fairly healthy individual. I don't have high blood pressure. I don't have diabetes. I don't have any of those things. And I'm thinking, my goodness, if somebody's got to pay $900 a month, where's that come out of their budget? It's not there. So we raised the income level 2.5 years ago to 300% above the federal poverty level to help with that.
Right. That's amazing. Because you're talking $900 like a month for help for a single person.
For one person.
Wow. That's why it's so important for people to know about the free clinic, because like I said, a lot of people can't afford health insurance on their jobs, or, a lot of people walking around and don't have health insurance for one reason or another. So definitely need it.
Let me give you some, I don't mean to start with some startling statistics, but according to DHEC, the South Carolina Department of Health and Environmental Control, Darlington County has more than 6,000 adults. Now, we only have 67,000 people in the county, roughly. We have more than 6,000 adults who have no health insurance. And a large percentage of those, like 16% of those, are not getting health care because they can't afford it. That means their high blood pressure and their diabetes, which are very prevalent in this part of the state, are not going treated. The South Carolina Best Chance Network says Darlington County has the highest mortality rate for breast cancer because our ladies are not getting screened. And with early screening makes all the difference in the world.
Right.
So we're trying to fill that void, let's take care of that. Let's
Right. And that was one of my questions too, Stephen. I had down to ask you, do you all do those types of testing, like mammograms, yearly PAPs for women, and all of that? Like, you all cover all of that at the free clinic?
We are part of what I just mentioned, the Best Chance Network. The Best Chance Network is a program provided by the state through the Department of Health and Environmental Control. And we started to get it done at the start of last year, 2020, but we all know what happened to 2020. So we finally have got it all kicked up and running, and we are now we can provide to our patients the annual pap smears. We work, and that's through the Best Chance Network. And if that test comes back abnormal, and I'm not a medical person, Veronica, I'm an administrator, so I might not use the right medical term, but if it comes back abnormal, then Best Chance is going to pick that up and say, okay, Mrs. Edwards, we need to get you to XYZ provider to do the next step. And all of that is paid for. It's no cost to the patient. Zero.
Oh.
We have a similar program through the Colorectal Cancer Prevention Network, where we can get free early, they're called FIT tests. And basically it's a private in-home test that people can do. It's primarily geared toward men, but anyone can get it that meets their eligibility. And if that test, then we can get the patients set up through the Colorectal Cancer Prevention Network for free colonoscopies and all of those types of services. And as through both of those networks, especially the colorectal cancer. I went to a seminar on this about just before the pandemic really started. Mm-hmm. On the scale, and I don't have these stats right in front of me, but the lowest incident rate in South Carolina for these cancers are in white females. Mm. Then just above that is white males. Then you've got black females. And then when you start talking about the colorectal cancer incident rate, black males are just off the charts. Mm. We want to help with that. We can help with that. We can get the screening and get you into the network. Anybody, race doesn't matter to us. We don't care. We want to help people have a healthy lifestyle.
Right. Y'all are Christian based?
We are a faith-based organization. We were created out of the Lord Cares ministry. We're supported heavily by churches in the county, but that is not a requirement to be a patient. You do not have to be a Christian to be a patient. Yeah. We have some Hindu patients. We have some Sikh patients. Beyond that, I don't know. That's not, we don't, when somebody applies, we don't say, well, you're a Christian. No.
Right.
We hope that our actions will demonstrate Christ's love. But we're not going to be there beating someone over the head with the Bible. We don't want somebody to stay up. We'd rather give you the medical care.
Right. Because everyone needs medical care, whether you're a Christian or not.
Absolutely. And Christ used some of the most despicable people, tax collectors and bums and drunkards and prostitutes to get his word out. So
exactly.
We are a faith-based. We do not provide any STD testing. We do not prescribe any opioids, painkillers.
Yeah.
We would not counsel in any way, shape, or form anyone seeking an abortion. We just wouldn't comment on it. We wouldn't say, go see these people who are going to talk you out of it, or go see these people who are going to talk you into it. That's not what we do. Yeah. That's between a woman and her family and her decision making. Right. We don't judge on that.
Now, Stephen, if you don't mind, can you tell the locations again? We have a question here from a viewer that says, is there a free clinic in Florence County?
There is a free clinic in Florence County. We have a clinic at 203 Grove Street, Darlington, and 500 West Carolina Avenue in Hartsville. The free clinic in Florence is Mercy Medicine. They are on Coit Street. I don't know their number on Coit Street, but they are Mercy Medicine in Florence is on Coit Street. And their program we're very similar. Our requirements are generally just about the same. What we do is just about the same. They may be able to do some things that we can't do and vice versa. But there is one in Florence. And they're great folks. They're fantastic folks.
So let's talk about the other services you all provide. Now, this is I didn't know this, and it's really good that you all provide free vision, dental. What other services do you all provide?
Well, let me talk about those couple of things real quick, and I'll tell you some of the other things. We've already talked about the Best Chance Network and the Colorectal Cancer Screening Network. Mm-hmm. We work with the Darlington Lions Club to provide vision screenings. Now, we've got to get that reignited because of the COVID. We had to suspend that one. And
Okay.
then based on that, based on the results of that screening, vision screening, we have a program with America's Best Vision Center in Florence where we can get our patients a free optometric exam and 2 pairs of eyeglasses. Now, they have been without an optometrist for the last couple of months, so we haven't been able to send people over there, but we do have that, and I'm sure that that will get rolling again pretty soon as well. We have other vision services that we can do. We have a couple of eye doctors in Hartsville, and we could not do this program without the wonderful support of our partner providers. McLeod Darlington, McLeod Health Center, Regional Health in Florence, Carolina Pines Regional Medical Center in Hartsville, Genesis Healthcare, Care South, and like in Hartsville, the PDI Associates, Jones Eye Center are great partners with us. Dr. Orville Dice in Hartsville, his office, a great partner to help take care of the indigent. So that's how we handle vision. We do not have an inside optometrist. Mm. On the dental side, what we have been able to do, we have collaborated with Florence Darlington Technical College's dental hygiene program. And free medical clinic patients, we can get over to their hygiene program when it's in session, and get our patients a free to the patient. The clinic pays for it, a free to the patient dental X-ray, cleaning, and screening. Okay, and then what we have several dentists, and I'm very thrilled to say Dr. Thelma Dawson in Darlington is, we're getting this rolling with her as well. We will be able to send our patients to, we send them to Sexton Dental Clinic. We're now going to be able to send them to Dr. Dawson. Dr. Flowers in Hartsville helps our patients out. Dr. Reynolds in Hartsville helps our patients out. So we're fortunate to have some network of supporting dentists, but they have limits on what they can do. So we can't guarantee every patient is going to get, the regular dental checkups. We have to prioritize it based on, severity and need and things of that nature. Right. So that's how we do the dental. We talked about best chance, and we talked about the colorectal cancer. Oh, a huge benefit that we're able to provide. Not only does our clinic offer the free primary health care through our wonderful volunteer doctors. Just tonight, Dr. Tom Dickinson was our doctor. We have Dr. Alex Cohen, Isaac Snap, and Patrick Nettles, all from Genesis Healthcare, volunteer with us.
Yeah, that's what I was going to ask. I didn't mean to cut you off, Steve. Yeah. They volunteered. Doctors
volunteer. They either volunteer one night a month or on an as-needed basis. And we have several doctors in Hartsville. We have Dr. John Rock and Dr. Terry Hassler, who are on our board of trustee directors. We also have Dr. Powell and Dr. Matt Chapman volunteer for in our Hartsville clinic. But we also have our own full-time provider, a physician assistant, Chrissy Huntley. She's been a phenomenally wonderful asset. Allows us to see more patients and provide a better continuity of care. So we have a PA that's there full-time, but she is supported by these doctors and some of the other specialists that I mentioned.
Nice. I mean, for doctors to volunteer their time, that's huge.
It is wonderful. It is huge. And the support we get from the two major hospitals, the Carolina Pines Regional Medical Center in Hartsville and McLeod Health Center, the McLeod Health Network, is just phenomenal. We absolutely could not do it without these folks. Could not do it.
So it goes the same for nurses as well. They volunteer, or how does that?
We have two volunteer RNs right now. One in Darlington that comes every Thursday, and then one in Hartsville that comes every Tuesday on our primary clinic nights. Beyond that, we have on staff a retired RN. Excuse me, I dropped my cheat sheet.
Oh.
We have a retired RN who does a lot of case management for us, who can handle most everything that a nurse, well, she's certainly qualified to handle everything, but because her license is expired, she can't give shots, she can't do certain things. But then our provider, Chrissy, or one of our doctors would handle that if somebody needed something when she was there. We also use a lot of interns. We've been very fortunate to collaborate with Dr. Deborah Hopla at the Francis Marion, the School of Nursing over there. We were able to get some students through that program and their healthcare administration who come in. We have two young people right now, one that just graduated from Francis Marion is looking to go to PA school. And we have a young man that's majoring in pre-med at Carolina that is home for the summer, is volunteering with us. So great group of volunteers.
Viewers, Sharon says, what a great service they are providing to the community. Great.
Thank you, Sharon. Tell people about us.
Yes. And like we said at the beginning, a lot of people do not know about the free clinic. And that's just like we was talking before we went on the air, and you was talking about the vaccine service that you all had yesterday. A lot of people didn't know about it.
We will have it again Monday. Care South's Moby unit will be at our clinic Monday from 9 to I believe it's 3 o'clock. There are no appointments required. They're offering the test or the vaccine. So come by the clinic in Darlington and get your vaccine.
And that's Monday from what time?
9 to I believe it's 3 o'clock. I know it's at least 1 o'clock. I believe it's 3 o'clock.
Now, as far as appointments have to be made, right? There's no walk-ins, correct?
Correct.
You can't walk into.
You have to be a patient for us to see you. We just can't take people off the street. So when you call, we had a patient call us this morning. Okay, he had been at the emergency room, McLeod emergency room Saturday. And I won't violate any HIPAA laws here, privacy laws, but They told him he needed to follow up with a primary care physician. He didn't have one. He called us this morning. Now, we didn't open until 11 o'clock. But he called us this morning, and our team told him what he needed to bring. He brought it. We got the medical records from McLeod. We're able to do that very quickly in most cases. We got him on the schedule tonight to see Dr. Tom Dickinson. So that's how quick it can happen. Right. Now, it doesn't always happen that way. That depends on two major things. How willing the patient is to accept our help.
Yeah.
And we're not a government entity, but there are certain things we have to require. We have to require proof of income. We have to require your residency and things like that. And there's a lot of reasons for that. And we're not trying to, but if you give away everything to people that can buy it, why would you, so.
Yeah, exactly.
So if somebody, this gentleman, okay, now the requirement, because of some of the third party things that we do, and I'm going to go back and touch on prescriptions in a minute. These third parties require this financial data more than we do. So we require it up front, because if we don't do it up front, we'll never get it. So they, for example, one place where we get a lot of free medications requires 1 month of pay stubs. This guy that called this morning, he only had 3 weeks. He was going to get paid today. We said, when you get paid, just bring us the 4th week. You need to see a doctor. But he came up, he filled out the paperwork, he brought his ID, his Social Security card, and we were able to get him an appointment tonight. I want to go back and tell you a quick success story. About a year and a half ago, we had a young, I call her young because she's a lot younger than me, 29-year-old black female walk in the door one day. She's not a patient. Said, I need a primary care doctor. What's your situation? We kind of verified that she was unemployed, low income, those sorts of things. She was complaining about a lump in her breast. This was on a Wednesday. Our staff was concerned. She was very cooperative. She wanted to help. She got us what we needed. We had her an appointment on Thursday night. By chance, it happened to be Dr. Tom Dickinson. He recognized there was a problem. Friday morning, we had this young lady at the radiology center at McLeod to get the right ultrasound, mammography, whatever it was. And that afternoon, the radiologist called us and said, free clinic, there's a problem. You need to get this patient back in. And by the way, we've already called McLeod Oncology. This, by Monday morning, we're back on the phone with this patient. We have asked her to come in that night. Dr. Dickinson came in that night. He wasn't volunteering. He had worked all day. He came in that night to talk with that young lady. Tuesday, 7 days after she walked in our clinic, we had her an appointment, and she was visiting McLeod Oncology. And the McLeod Cancer Foundation took things over from that point. Had we not been there,
right,
would she have not sought out the help somewhere else? I hope she would have. And if she's listened, God bless you. We're so thankful we could be a small part of that.
Right.
I fear for the people that don't have it. And I'm so thankful we were there for her. And I can tell you more, but
because she didn't have health insurance, she didn't know where else to turn. But knowing that you all was a free clinic,
right,
she came to your door like, wow.
And
for you all to have that quick turnaround, for her to be able to get the care that she needed.
Again, I'd love to say that's going to happen every time, but we're small. We have 3.5 employees and counting myself.
Yeah.
And I can't always promise that, but in that case, it worked out. And we're going to do everything we can to make that happen.
Well, thank God for you all and your service to the community. That's for sure. we have some comments coming in. Sharon said that, well, first of all, she said she sure will get the word out. She had no idea about the clinic either. And she says, do they have a web page or a schedule available online?
We do have a web page. We have a web page and a Facebook page. The web page is www.freemedicalclinicdc, as in Darlington County, .com. But, wait a minute. .com or .org? Let me look that up real quick. I'm having second thought. And our Facebook page, if you can search for Free Medical Clinic of Darlington County, and it will show up.
Okay. They're having a really great program going on. And that's
one thing, Veronica, we have not talked about, and I do want to mention is freemedicalclinicdc.org. Not .com, but .org.
Okay.
We do not have a schedule. You can't schedule an appointment online. Unfortunately, in our webpage, we have a volunteer, very nice gentleman that takes care of it, but it's a little bit more of a challenge for us to keep that as updated as we'd like, because we are small in number. But all you have to do is call the office, and the phone number is 843-398-0060. And it doesn't matter whether we're in Hartsville or Darlington. When you call, we will get the call. I need to tell you real quick about prescriptions. We've talked about the medical care, but we have our own pharmacy. Now, we're not CVS, and we're not Walgreens, and we're not Darlington Family Pharmacy. Darlington Family Pharmacy, if you all need a pharmacy need in Darlington, I so urge you to contact Terry Lewis and those folks. They are wonderful. They support us tremendously. They're a local business, and they just do a lot of great stuff. But we have our own pharmacy. And our goal, we don't, again, we do no painkillers, no opioids, nothing like that. We have primarily diabetic related drugs. We don't keep insulin. We can't afford it, but we can get it for you, but we just don't keep it. We primarily have diabetic and high blood pressure related. And we keep a handful of antibiotics in stock. So the gentleman that showed up today, he needed an antibiotic, and Dr. Dickinson wanted him on that antibiotic tonight. So we were able to fill that prescription in our pharmacy and hand it to him before he left at no cost.
Amazing.
Now, that's why we have to get the financial information we have, because we can't get these medicines if we get audited and so let's say that, well, the gentleman came in tonight with high blood pressure too. He's going to need to be on a blood pressure medicine. In our pharmacy, we're going to fill that first 30 days of blood pressure medicine. And then we're going to get him on a program it's called Well Vista. And their income, they're very, very strict about their income limits. And then Well Vista provides free prescriptions.
Okay.
So in 2020, despite the pandemic, we wrote and got for our patients 8,151 free 30-day prescriptions.
Now, after these 30 days, do they go on, are they able to go like on a payment plan, or?
There is no payment plan for anything we do. All of this that we've just talked about is free to the patient. Now, for those that are above 200% of the poverty level and up to the 300, the only thing that they will have to pay for is lab work. But it's $10 per lab. And they pay, we just are not able, we've not been able to negotiate it any lower. And that is the only thing. But if any of your listeners or viewers have gone and gotten lab work, it's hundreds and hundreds of dollars that they charge.
Right.
And we get it for them for $10. They do have to pay that. And if we cannot guarantee that we can pay for things outside of our office. Okay. So we can't pay for x-rays. We have, a very good rate set up for patients at Carolina Pines. We can't promise we're going to pay for an MRI or a CAT scan, but we've gone out and found the best possible rates. And we educate the patient on how to work with the hospital to get in their low-income patient programs, or to have it written off entirely, or how to set up a payment plan. These hospitals will take $10 a month, $20 a month. So, we can't guarantee we're going to cover those costs. We will do everything we can to help a patient, but we can't guarantee that.
And I think I kind of got confused. That's why I asked about a payment plan, because when you said the 30-day.
Okay. We fill the 30-day prescription in our pharmacy.
Okay.
Because let's say this patient, use him as an example that we got in today. All right. He's probably going to qualify for this program I just referred to called Well Vista. But it's going to take about 2 to 3 weeks for the Well Vista to kick in. So what our goal is we give him enough medicine out of our pharmacy to get him to when Well Vista starts sending him the free medications.
Gotcha now. Okay. I was confused on that part. Okay, I get you now. All right. So we have another comment that came through. Mr. Sammy says, "This is a great program. I come through that area often, but hardly ever see any cars there." And Mr. Sammy, he asked, "What are your hours of operation?" I know you went over that earlier, but if you don't mind, can you?
Mr. Sammy, our hours in Darlington are 9 to 5 on Wednesdays, 11 to 7 on Thursdays, and 9 to 4 on Fridays. And yes, it's particularly with the pandemic, you will not see many cars. That does not mean we're not open. Many of our patients do not have reliable transportation.
Ooh, that was a question I had down.
Okay.
Do y'all provide transportation to and from? Yeah.
We do not, but we partnered with the great folks at PD Regional Transportation Authority, and you can get a PD RTA bus anywhere in Darlington and get to within 100 yards of our clinic. The bus stop is right across the street from the IGL Main Street, and we're right behind that church. And the PDRTA, for a patient without transportation, if we need to get them to one of these, like the dental hygiene program or whatever, we can get you via PDRTA to any medical facility in Florence, any, free of charge. So one reason we don't have a lot of people in the lot, because there's only 4 staff people total. Many of our patients do not have transportation.
Yeah.
And with the pandemic, our office remains locked, and we only allow the patient in the clinic. We don't allow family members and all that, until we get rid of this COVID. So that's a lot of the reasons why you don't see many cars, but we're there Wednesday, Thursday, and Friday.
Wednesday, Thursday, and Friday. And that is the Darlington Clinic.
And
the
Monday and
Hartsville
Tuesday
Clinic.
in Hartsville.
Yeah, Monday and Tuesday in Hartsville. This was some very good, important information tonight, Mr. Stephen.
Thank you. And if anyone wants me to come speak at your civic group, your circle, your church group, we will come. We have volunteers. If you're having something and you want blood pressure screenings, if we get enough advance notice, we can generally get someone there. But because I have to rely on volunteers for a lot of this, I need some advance notice. But we will come out. We'll do blood pressure screenings. We'll tell you about our program. We'll bring applications. We're happy. I'm happy to come to your group and tell you more about and help people. We want to. I want to.
Well, hats go off to all the volunteers, yourself, the doctors, the nurses, everyone that's volunteering their time to care about someone's health. That's so important. It's such a big deal. So our hats goes off to all of you for trying to make a better community, better health services for the people that's walking around and don't have health insurance, and just to know that they have a place where they can go and get treated for their health. I mean, that's so important. Like, your health is important. We all know that.
It is. There's a lot of love and care that comes out of our office, and the people that are there. I want to tell you one more quick story, if you'll allow me, Veronica. We had this gentleman come in about 6-8 months ago, and maybe a little bit longer. I lose track of time, and he had a number of health issues, and he had some alcohol addiction issues, and we had to give him some tough love along the way. And I'm just so thrilled that we talked to him the other day. We got him in a local program, and the difference in this man, and he gives God the credit, and we were a small part of getting him there. But wow, when we can when we can hear those types of impacts, it makes it all worth it. It just makes it all worth it.
Right. Yeah, when you're doing stuff from the heart and you genuinely care about people's well-being, like, that is so important. That's so important. So once again, we thank.
A little bit more of that these days, couldn't it?
What a better world this would be.
Yes.
Definitely. Latasha had a question. Are the COVID vaccinations being administered at the Darlington Clinic on Monday?
Yes, ma'am. I know it's 9 to 1. I think it's 9 to 3. But I didn't bring that home with me tonight. If you go to our Facebook page, we had a post on there a couple of days ago about the hours for that, and that is Care South that is helping us with that. We were approved to be a vaccination site, but the reporting requirements that the government required, we couldn't meet them. We just could not meet them. And it kind of hurt that we couldn't, but I understand why they're having those requirements, but we just could not meet them. So we partnered with Care South to come do it, and very thankful that have been coming.
Yeah, thank God for Care South. Sharon had a question. Do you all take or need volunteers?
We are always in need of volunteers. Volunteers, especially right now on the administrative side, just to help us with. We get a lot of things donated to us that we turn around and donate to the public. Gauze, Band-Aids, diapers, pull-ups, chucks, wheelchairs, walkers, things like that. And sometimes we just need volunteers to come in and help us sort that stuff and do that type of stuff. We will never turn away a medical volunteer. We need volunteers if you're able to, like I said, do blood pressure things and help represent the clinic out in the community. Those are big volunteer needs. So yes, if you have a passion for helping people, we're going to figure out something.
Okay. Now, and we're going to wrap it up, but by you all being a 501c3 non-profit organization, you rely on churches and the hospitals to actually pretty much get things done, right?
Right. We rely on individual donors. We rely on church donations. I write a lot of grants. That's why I spend a lot of time writing for grants, and we're supported by some wonderful organizations. The Byerly Foundation, the PD Electric Cooperative has been a big, Wilson Senior Care, Nucor Steel, and I'm afraid to leave somebody out. I mean, banks and businesses all over the county support us. Churches support us, individuals. The Blue Cross Blue Shield Foundation of South Carolina is a huge supporter. Cokers. Wow, I could go on. We South Carolina Physicians Care. That's where we get our funding. The hospitals, they do support us financially, and I don't want to minimize that at all. But the greatest support they give and support us with is providing these services at either substantially, I'm talking about huge discounts, or getting them written off, or something like that, or supporting us through. We have a number of Carolina Pines folks that support us, with their volunteer hours. Dr. Powell, Dr. Chapman, Dr. Hassler. They're just wonderful to us. They're wonderful to the people of Darlington County. Both they and McLeod Regional Medical Center are fantastic partners.
Awesome. Let's backtrack to donations, and then we're going to wrap it up. Donations. Where do they drop the donations off at the Darlington Clinic during the hours that you all are open? How does that work if anyone wants to donate items?
Best thing to do is call ahead. Let us know. There's some things we cannot take. We cannot. The pharmacy board will not allow us to take any medication. I wish we could, but we can't.
Right.
We cannot take open packages of things. So if you got a box of Band-Aids and you wanted to give us the box, even though all the Band-Aid, we can't take that. But if you have somebody gave us 4 or 5 cases of diapers, adult diapers recently, we can take that, walkers, and then we make them available. Someone that needs a walker, give me a call. I might have one. I might have 10 this week, but next week I don't have any, and it just kind of runs in cycles like that, So yeah. Call the clinic, and I've been known to go pick things up. But if it's things like that, we ask you to drop them by the clinic. And if you need something, give the clinic a call.
And that number again?
843-398-0060.
Stephen, thank you so much. This is
Oh, this
so
has been wonderful. I appreciate the opportunity.
yeah, such an important information for the viewers to know. Once again, this is a free clinic in Darlington County that we're talking about. Free medical clinic located 203 Grove Street in Darlington. There's also a clinic in Hartsville as well. And what's that address, Stephen, in Hartsville?
500 West Carolina Avenue.
So guys, if you are someone you know is in need of medical care and they do not have insurance, please reach out to the free medical clinic of Darlington County. The location is 203 Grove Street in Darlington. And please call first 843-398-0060. That's 843-398-0060. Stephen, it's been a pleasure tonight speaking with you.
Thank you very much. I appreciate it. This has been great. I've enjoyed it.
Oh, you're welcome. Anytime, because people need to know what's available in their area. A lot of people don't know about this clinic, like I say, and, it's so important to get the word out so that people can take care of their health. Health is so important. So we definitely appreciate you. Appreciate all the volunteers that help out there. May God bless all of you. So important.
Thank you.
Thank
Keep
you so
us and our patients in your prayers. That's the biggest thing we ask for.
Of course, sure will. Thank you again for coming tonight and sharing this information with everyone. Guys, thank you so much for watching Tangy Tea of Life tonight. I appreciate each and every one of you. Very important interview tonight. But once again, the Darlington Free Medical Clinic located 203 Grove Street in Darlington, 203 Grove Street in Darlington. And there's also a location in Hartsville as well. And Stephen, once again, that location in Hartsville, I don't think I wrote that one down.
500 West Carolina Avenue.
And the number in Darlington is 843-398-0060. Guys, once again, thank you so much for watching. Thank you all for your comments. And please spread the word about the free medical clinic in Darlington, 203 Grove Street. Spread the word so that everyone can have good health and get the health services that they need. Once again, thank you so much, Stephen, for joining me tonight. Guys, have a great night. And Stephen, if you can hold on just for a second for me. Guys, have a great night. Enjoy your weekend. And thank you so much for watching Tangy Tea of Life. God willing, we'll be back with you on Tuesday night. See you guys then.